We're learning the Virginia Department of Health didn't use millions of dollars meant for the oversight of healthcare facilities. It's money that could have been utilized during a time when nursing home inspections were falling behind and consumer complaints were going up. Right now, VDH's Office of Licensure and Certification, or OLC, is being overhauled, with state leaders racing to fill vacancies of nursing home inspectors amid increasing concern about quality of care in facilities. As we've told you, the understaffed OLC has been failing to complete timely inspections and was the subject of previous CBS 6 investigations in which families voiced frustration with slow responses to their complaints.
I found it very disheartening that the Department of Health had not responded.
Get off your rear ends and do something about this.
An internal study of the office responsible for nursing home oversight would later reveal critical positions remained vacant for years, and that inspectors, also called surveyors, lacked training and weren't given the necessary resources to successfully do their jobs, which Toby Edelman with the Center for Medicare Advocacy says are essential to protecting vulnerable residents.
If the surveyors don't come in, facilities decline in the quality of care they're providing. It's very important that people be there and that a problem be identified quickly and corrected before it affects other people.
While many factors contributed to these problems, the health commissioner in part blamed inadequate funding from the Centers for Medicare and Medicaid Services, or CMS, which oversees each state's inspection program.
Well, part of the problem with our staffing issues is the funding for the staffing. CMS, we've had stable flat funding from CMS since 2015.
And that limited funding was in part why VDH successfully requested this year that lawmakers raise facility licensing fees to get more state money to hire inspectors. But according to CMS, VDH may not have been maximizing all the federal funding available. CMS gives VDH about $7 to $8 million per year for healthcare facility regulation, much of which is used for payroll. But in the most recent years of complete data, fiscal years 2021 through 2023, CMS says Virginia returned a total of $2.4 million in unspent federal funds. CMS says that money is meant for salaries, hiring new staff, recruitment efforts, contractor support for inspections and complaint investigations, enhanced training, and other resources that support oversight activities.
So not to use the money they have or that they're given seems really troubling. You could hire more staff, pay better wages, make sure that they go to training conferences, that they know what they're doing, help them pass the test. There are important things that money could have been used for.
However, VDH says its system shows a return of $882,000 in drawn down CMS funds during the years in question due to accounting adjustments. VDH says the difference between its and CMS's numbers could be explained by a shift in appropriation among states, but did not provide a definitive answer. For fiscal year 2024, which has not yet been officially closed out, VDH did not draw down an additional roughly $4 million in federal funds. The state says it's going back to use as much of that money as possible. CMS has not said how much, if any, could be left over. Overall, VDH tells me that the grants remained active, incurred additional expenses, and that VDH continued to receive reimbursements from CMS during the time period in question. Here at VDH, I'm Tyler Lane for CBS 6 News.